I wanted to thank Marty Gallagher from Greater Rockingham Area Services, who's here. I wanted to thank Scott Pickup, town manager of Rockingham, as well as Bob Adcock. So all of them have been at my side trying to find ways to really move through this and change maybe an outcome. We're at a place where we've made a decision. We have to consolidate Rockingham Health Center into Springfield Health Center and Charlestown Health Center, and as of January 1st. But there's certainly been a lot of outreach from folks trying to find ways to keep that from happening. Can you all hear me in the back? I just want to make sure. Okay, thank you. I'll try to speak up a little bit louder. It's a tough time for healthcare in the state of Vermont. We are a federally qualified health center that is a primary care, behavioral health, vision, and dental organization. We are responsible for about 24,000 patients, and about 10% of those patients are in the Rockingham service area. We have, for many, many years, worked alongside the Springfield Hospital. You may remember, you may have been at some conversations that we've had here in Bellows Falls at the library when we spoke about Chapter 11. You can remember that we are one of the organizations that went through Chapter 11 reorganization back in 2019 and 2020. We have seen difficulties continuing since we've been independent, FQHC, on our own. That FQHC operates throughout Vermont. We have one site, obviously, in Charlestown, New Hampshire. And we really have seen a decrease in patient use of many of our sites, this one in particularly, which has been difficult for us. That difficulty is also matched with difficulties around recruiting. It's been hard for us to recruit providers, frontline staff. If you've tried to answer the phone, if we've tried to answer the phone when you're trying to call, sometimes you know that's hard. It's been difficult for us to have people to answer that phone. In the news today, in WCAX, there was some announcements from UVM Medical Center about the reduction in some programs throughout the state of Vermont. They have eliminated about 200 positions. They have also eliminated some services, or are working to eliminate some services. We also had heard that at Gifford Health Center in Randolph, Vermont, also eliminated services today, immediately. Many of you are probably aware of Act 167 that was highlighted in our press release, which is really Green Mountain Care Board, Oliver Wyman report about how to do their best to consolidate, reduce the cost for healthcare in the state of Vermont. I can tell you that the state of healthcare in Vermont is very broken. I can tell you it's getting harder and harder for my organization as an FQHC to do what we do every day. And we take care of anybody and everybody who shows up, regardless of race, ethnicity, gender, ability to pay. And what I am finding is the reimbursement that we receive from various payers is outmatched by cost. We're all struggling right now, I'm sure, with groceries at the grocery store, fuel, expenses. That hits us as well. And we have had many different increases in staffing, but we have not seen that reimbursement follow through from various insurance payers. And so that keeps us losing funding. We are a business. Unfortunately, we have to break even. We are a not-for-profit 501c3. We are not rolling in money by any means. This year, we're going to lose about 10% from our bottom line. We wouldn't be here if we kept losing 10%. We don't have that type of cash in the bank. We went through Chapter 11 reorganization that obliterated all of our investments, all of our cash, and everything else. And so if you think about it, if I can put it into terms that I like to use, I like to get to how it would affect me. In real terms, it's if you have $3 in your piggy bank, and that's what you have in your piggy bank every month, but you have a $4 bill that starts to come. It used to be 3, but it's gone up and now it's 4. You got to find that extra dollar. And I have been in contact with local, I've been in contact with state, federal delegates, trying to find different ways that we can have increases in our reimbursement for the healthcare delivery that we offer to our patients. And right now, I am not seeing activity that would help us cover our costs. So I have to shift our organization, change our footprint, reduce our costs. One of the things that breaks my heart, and I had a good conversation with a physician today, is that we really are stuck in a world of fee for service. Now, I know not everybody knows what that means, but in healthcare, we get paid for a patient coming in and being seen by a provider, not necessarily a nurse, but by a medical staff person. A lot of the times, if we collect that funding from insurance, or if it goes to financial aid, or if it goes to bad debt, let's just say we collect that funding. We don't have a way to continue to offer those services with the rising labor costs and supply costs and whatnot if those pieces don't change. So what that forces me to do is speak to my medical staff, some of who are in this room right now, and say the only way that we can get out of this is if you start to see more patients each day. And that's a fee-for-service model. And I can tell you right now, post-pandemic, which is certainly the same time that we went through Chapter 11 reorganization, people are sicker. People are putting off care. I can tell you right now, people are putting off care. They don't want to pay co-pays. They don't want to pay deductibles. We're not getting paid because they're not coming in, and they're getting sicker. We're seeing people with chronic conditions, comorbidities, end up in the emergency room. Sometimes beyond the emergency room, transferred to subspecialty care, which is much, much more expensive than primary care. An analogy that I use a lot of the times is if it's your vehicle, you got to change the oil. It's the same as our bodies. We have to take care of our bodies. And if we put that off, we end up in a place where we're going to have chronic conditions that'll have us on pharmaceuticals for the rest of our lives. And the cost of healthcare will continue to rise. So I can tell you, I can't ask all of my medical staff to start to see 20 patients a day. Right now, taking care of the patients that we see, we're trying to get to 16 a day and maintain healthy outcomes for patients. I think that's possible. We're trying to recruit people that are retiring. We've lost some physicians that have retired. Somebody that was with us for a very long time recently passed away. Pillars of our organization. And as I recruit in new clinicians, they're still learning. They're still taking their time coming up to speed. That means they're not going to see the higher numbers that I would like to see, which therefore erodes reimbursement and doubles our costs if we have two people doing what one person once did. For our organization, there's no more costs to cut. And I think that's important for everybody to understand. We have eliminated services in radiology. Used to have an x-ray machine when I managed this site. There was an x-ray machine at the end of the walk-in hallway. Many of you may have gotten a picture taken in there. We had to remove x-ray from all of our sites because the fee-for-service or the reimbursement for the x-ray wouldn't cover the cost of staffing the x-ray room for the tech or the capital investment of the equipment. So that was the first item we had to remove this year. Lifestyle medicine, which is really, if anybody knew Scott Durgan, friend of mine, physician, who really spent time with people talking about diet, exercise, sleep, stress reduction, all the things we would like. Well, maybe not the exercise part, but at least stress reduction and sleep, right? That was a service line that saw one patient an hour, and it would not break even. And I couldn't subsidize it any longer, and that had to be eliminated. We have consolidated our Ludlow Dental site into Chester Dental. So if anybody had ever gone to Ludlow Dental, FQHCs, again, the Federally Qualified Health Center is the only dental agency that, not the only, but one of the only that take Medicaid patients and people that cannot pay for their services. So if folks need care for dental care, Federally Qualified Health Centers lead that charge. That comes with lacking reimbursement as well. So really removing overhead by removing Ludlow Dental out of Ludlow, Vermont, and then moving everybody into Chester Dental worked pretty well. There's some travel associated with that, and I'll get to that in just a minute. And then also moving to the Rockingham side. So I know there's a lot of emotion in the room. There is for me too. I spent 4.5 years here, as I said. why is this happening to us? And I think I tried to answer a lot of that question of why this happens right now. This is one of the most walkable villages in Vermont, right? And so it's easy to get from one place to the next. And I know we got to help with that. We've asked some transportation organizations to be here tonight. I don't know if there's any in the room tonight that will be helping us with transportation for patients to get to Springfield Health Center and Charlestown Health Center. Mostly about 10 miles away, but if you're walking, 10 miles is a long time, and if you can't walk, it's impossible, right? So we don't want to have that happen. So we want to work with our patients to try to get them to those locations. One piece that was really important to me is not to lose employees, and we've done that fairly well. Our organization will be transferring employees of Rockingham Health Center to Springfield Health Center and to Charlestown Health Center. It's important to me to take care of those employees that have given so much to our organization. Some people have been here for over 30 years to really help us. So I continue to reduce overhead the best that I can, which is property, plant, capital expenses, and those type of things that are not people, because we still need to provide care to roughly 30,000 people. And I know what this means for many of you. I know what this means for Greater Rockingham Area Services. This is a difficult thing because we are a large tenant in their organization. And so I think with that, everybody got a handout. I'll just acknowledge that. If you didn't get a handout, we can get some more. But that has all details about a bit of what I'm speaking with and also where folks are going to go for providers and where staff will end up. So that should answer some of those questions if people have those. We have members of our community health team in the room. We have members of, I think, the transportation folks. And we also have some time for questions. So I've been a bit efficient, but I'd like to open it up for questions. And if you're a patient, please ask us some questions. If you have other concerns, we're open for that too.
I want to say that it was really difficult. The first place that I heard of this was in the Chester Telegraph online. And then I couldn't figure out, like, why was this in the Chester Telegraph? And why did I not know anything before this all happened? And then I was talking, previous to that, I had my best friend and someone in my family both say to me, yeah, my healthcare provider left, and they told me that they would, this was several years ago, they told me that it wouldn't be a problem, someone else would pick me up, and then I couldn't get anybody on the phone. So I couldn't find the Chester Telegraph letter again, and I didn't recognize you because you have more hair than you had. At least here on that, in that piece. But it felt like, what do you mean you only have half the people coming there? You don't call anybody back and you get rid of people and you don't get more people in. What did you think was going to happen? Duh.
Yes.
Did you take arithmetic? So that was my first thought on this. And then I started to think about all the big mess here. So as a nurse who had 3 babies here at Rockingham Hospital, the other thing that I worry about is pediatrics. And I'm worrying about immunizations in the schools.
Yes.
That is one of my really big, because I know that that's already something that people are thinking about. And I'm wondering, who's on it? Who's on it? Who are we looking to? Because I think we've sort of seen the people here as healthcare leaders for us. Maybe they didn't see themselves that way, but it's a small town and we know them. And we're like, okay, who's going to care about us anymore? So, thank you.
Thank you.
Thank you.
So I'll acknowledge that the communication on the Chester Telegraph probably wasn't the best, for sure, way to hear about this. And I'll own some of that. What we tried to do is I had some conversation with some individuals very early because I wanted them to know that this might be happening. I was hoping that we would find some additional funding somewhere to help this not happen. And I also wanted to speak to my employees before folks knew. And so there was a gap of time that happened before we were able to make our announcement, and we certainly were beat to the press by somebody else. I've promised my staff they'll never hear anything from the press before they hear from me. And to the best of my ability, that's what I've tried to do. But it failed in this situation with patients. I do think to the school piece too, I just want to address that. We have school-based clinics in Springfield. We don't have school-based clinics down here. We do have pediatricians in Springfield. Of course, Dr. Hall will be helping us in Springfield. But we will not leave those schools out of the picture in this area. I think immunizations are some of the most important things we can do for our children. And we see a lot of pushback now, more than that we've ever seen. So really that education is going to be paramount.
Well, make it harder. And they weren't thinking it was all that important anyway.
Right.
Just you want to make it as simple as possible.
We do have, so this, I will also address that the service area of Rockingham and Bellas Falls is going to continue as a service area of the federally qualified health center. What that means is we still want to be responsible for the patient population that's here. We do have a mobile unit that we can bring to schools as well and help with students and educators, people with, if we went to like a career center where there's a larger group of folks that we can take care of all at once. It's not perfect, but it's a solution that we've used before that's been effective. Yep, you're welcome.
Yes, I think it's just sad that the community was not bought into this before so that we could help you find a solution. I think many of us, the health center became a little invisible. Our doctor would leave, and I've heard from so many people that they cannot find a primary provider. And so it just seems like this could have been worked on before until we get the word at the very last minute. You might have had local factories and businesses who could have reached out to their employees, to kind of get ahead of this. So my only comment on that.
Agreed.
I think that's a fair point. It's one of those pieces where when we went through Chapter 11 reorganization, we looked at every single one of our sites and see what makes sense, what doesn't make sense. I had aspirations that we would grow under Northstar Health. We would continue to have additional revenue. We could invest in places. That did not certainly happen, unfortunately for us. As I spoke with those individual stakeholders about potential ways that we could probably have something to continue with Rockingham, it's about an $800,000 difference. So if that gives you, I didn't really give you a number earlier, but it's about $800,000 annually. With nothing else changing. And I know for a fact there's such a scarcity of primary care folks. The people that answer the phones or try to answer the phones, there's not enough of them. And so we bring in people that are answering the phones that could get jobs that get paid much better elsewhere. And they're taking a lot of heat on the phones too. And they come to me and they say, hey, I got screamed at on the phone. I don't know if this is for me. And that makes it really hard for me to retain employees. And so I don't think I addressed all of your question, but I really think that's, what was the one other point that you had? I just want to make sure I don't skip it here.
Well, I think
To get everybody together.
Like for instance, Dr. Peak was our provider.
Yep.
So then we tried to find another doctor, and so I think a lot of us dropped off through the years, and the health center was not well promoted. It could have been as simple as going to every business in town and, talking about the importance of us not becoming a healthcare desert.
Mm-hmm.
And I don't think those steps ever happened.
Okay. Maybe we could have done that better. I can tell you that I certainly have not seen, the level that would have helped us, but maybe we could have done that better. Go ahead.
I'm going to tell you a little bit about me before I get into questions for you, Josh.
Yep.
My name is Kelly Hopkins. My father was born here. My husband and I moved right over there. I can see this from my porch in stick season. A couple of years ago, my great uncle was one of the town doctors in Walpole, used to patch people up and deliver babies here. So this place means a lot to me, despite the fact that I haven't actually lived in Vermont for very long. One of the reasons we bought our house where we did is because I am disabled. You can't see it, but I am, and I have been since birth. And one of the things I cannot do is drive. I cannot get to Springfield without my husband's help. I cannot get anywhere else that I can't walk to. Springfield is not walkable, neither is Charlestown, without somebody to drive. And I understand that you've talked about finding community resources and other ways to get people places. But one of the things I also am is a labor and disability advocate. My master's degree is in labor and disability. So hearing that you are closing this place and hopefully nobody's losing their job, I'm going to be upset if I find out that that's the case, because I think you sound like that's not happening. But I'm also hearing a lot of CEOs speak, like, we could have done that better, or perhaps that was not anticipated. And when we're talking about creating a healthcare desert in this county and southern Windsor County, CEO speak is not acceptable. People in this room are angry. And what we need from you is honesty. If you're telling me that $800,000 is the reason that we are all now losing access to urgent care, to pediatrics, to all the other things that we got from this place, I'm telling you, you didn't try hard enough. I'm not okay with that. I'm also telling you that money is coming out of my pocket because of your decision. And here's why. I now have to find a way to take time off of work. And right now, I don't have paid time off. There are plenty of people in this room who are going to have to find ways to take paid time off of work if they have it, or unpaid like me, to find someone to take them to a much farther away hospital. That's money out of our pocket to go to a hospital appointment that they may or may not actually have to go to, because we have to make that judgment call. Is it worth it to go to the hospital or to the doctor to get this looked at, or can I put it off? And you were talking about that earlier as if that's something people have a choice about. Many of us do not. I don't. If I'm not feeling well, I have to decide whether or not I'm going to work that time. I'm here right now when I should be working, because it's more important to me to talk to you and everybody else involved in this decision than it is to be working. And then I'm going to go back and log back in and work a longer day, because this is more important. Most people here don't have a choice when it comes to, can I get someplace else? How is that going to affect my bottom line? Can I afford my milk? Can I afford what my kids need? That's a decision that we have to make. And I understand that you have a whole bunch of people and an organization that you're responsible for. But if we all learned about this from the paper, I learned about it from the shopper.
I learned it from Facebook.
Right. How do we have any guarantee that you actually worked hard enough to make sure that this is the right decision? How do we know that? I don't know that. And quite frankly, I don't believe you. And I'm upset. You can tell. I'm sure you can tell. But I need to know, is everybody going to keep their job? How am I going to get from point A to point B? Or do I have to call my husband to come home from his job to take me someplace if I need to get to a physical therapy appointment or to something else? Because that costs me even more money. Are you setting me up with some community transport? How do I know it's safe? How do I know I'm going to be in the car with somebody I can trust?
Reliable.
How do you know they're
How
going
do
to
you
show
know
up?
that they're going to show up? How do you know it's going to be reliable? Have you thought this through? And if you haven't, when are we going to find out? When are we going to know? Do you know what you've just done to the property value of my house? You're costing me money. And I'm not even here because I'm mad about the money. I'm mad because I had no say. And nobody else in this room did either. No say. This never came up as something to talk about. There was no problem-solving opportunity for the community. There was no talking to any of the employers around here. Nothing. It showed up in the newspaper. Facebook, thank you. And on social media. You should be ashamed of yourself. So yes, people are upset in this room, and there's tension in this room. Do better.
I'm not going to say that he was doing the worst job in the
Oh,
world.
I didn't say worst. You're absolutely right.
I'm not saying that he could have done better. We all can do better. Everything we do in our lives, including me not having enough patience with my brother who's disabled. But I am a VA vet. There are some others in this room that I see that are VA vets. We don't have a choice always about where we get to go. We can only go to White River or down to Massachusetts or way over to New Hampshire. We have to make it work. We've been allowed sometimes to come down to do the therapy, the physical therapy, because they were having short staff up there. So they were able to get some stuff. Everything is changing life. When it shouldn't hold it against somebody else because of what maybe we could put out to.
You have a facility at 100 River Street.
Yes, I do.
You have another facility over in Charlestown at 250 Cedar Road. Those are within 6.1 miles of each other. And then you have this facility, which is down here 15 miles away. And I don't understand why thought wasn't given to only having one facility up there so we could keep the one down here. I just find it amazing. It's like somebody was blind. I mean, you don't need two up there. I mean, I went up, looked up, I've got all the data here. And I could not believe that they're that close together and nobody thought, we don't really need these two together. We've got a little clinic 6.1 miles down the road in Springfield, or send Springfield over to Charlestown. But we're down here. We need to have a facility here. There are too many people here that don't have cars, elderly people. And it's going to be a mess. And I don't think it really was thought out. I don't think it was organized. You were fixing over one was an old building up there, like you keep saying, this is an old building down here. Well, it looks pretty darn good. It needs work, but it's not saying that it couldn't get fixed. But you had that when you just spent money, fixing over the old mill, a lot of money. And then you build a new building over in Charlestown, right next to each other. It doesn't compute.
Good point.
I'm happy to answer some of that if people would like, but I also want to get through a lot of questions too. We received, so the mill in Springfield, so 100 River Street was paid for primarily with grants. And that was really through HHS. If I were to close that site, I don't have a place to put everybody. There's no other buildings that I could occupy, unfortunately. They have some space where I could occupy with the individuals that are practicing here. And so that allows me to flex that way. Charlestown's in New Hampshire is very different than that of the healthcare environment in Vermont. It's not easier, but it's different. That building's paid for. We don't pay any rent for it. That was paid for by a grant as well. That was a Health and Human Resources grant, or HRSA, Health Resources and Services Administrative grant, as well as a private donor that paid for those sites. So unfortunately, it's the operating cost that's carried from month to month. That site in Charlestown is profitable. It's our only site that's profitable.
So we dump on them and overload them with people from here. Last time I was over in Charlestown, I sat there for 3.5 to 4 hours waiting for someone to be seen. What's going to happen when you send this kind of overflow to Charlestown? Are people going to sit there like 8, 10, 12 hours waiting to be seen? That's wrong.
No, I hope not.
And there are no grants available to purchase this building?
No, there's not. Not that I've found. Yes, ma'am.
I think you've made it a self-fulfilling prophecy. We used to get our vaccines here. They used to have clinics and we'd come up here and get our vaccines. You gave that up to Walgreens.
We're not reimbursed for vaccines like we used to be. And Walgreens it's I got to tell you, the medical industry is broken right now. It was so much easier for us to have a refrigerator here, and when you're here for your appointment, we're able to just say, thanks for coming in, do your physical or whatever. You need your immunizations, let's give you those. Now there's no reimbursement for an FQHC. We lose money on every vaccine, not every vaccine, but some vaccines. We're also given some vaccines by the state of Vermont. But that is why you've seen some of that shift to pharmacies.
Well, and it's also very hard to get anyone to answer the phone. You're waiting to make an appointment, something's happened, there's no one that you can call. You're waiting. I just found out last week that I had to go to Springfield for my labs. Nobody told me. I have an appointment next week with Anna. No one told me. We used to have a lab person here. All of a sudden, we don't have a lab person here. I mean, it's like, of course we're gonna be sent to someplace else. We're not providing it and you're purposely not doing that
Kind of pushing us
And
away.
not telling us.
and not telling us
Not
about it.
transparent is what you're,
Yeah, the
Yeah.
transparency's been,
and terrible,
So
absolutely lousy.
let me first start with, I will tell you, if we don't do this, and this is happening, I have to do it, the whole site goes down. There's no healthcare in Springfield, there's no healthcare in Ludlow, there's none in Londonderry, there's none in Charlestown for primary care. And so what I have to do, I want to make sure people understand, I don't love this idea. I never once said, I can't wait to close Rockingham. If I could, I would keep it open for as long as I possibly can, but that's jeopardizing the entire organization, and I can't do that.
I have a question from somebody on Facebook because I posted this. They want to know what's happening with your existing appointments if they already have one. I have one that happens to be next week, but we have appointments that are scheduled out in January. Does that mean that our appointments automatically go to Charlestown or wherever?
Yes.
Okay, I'll let them know.
I saw somebody, yep.
Has there been any work done to find another provider, another organization that could possibly take this over
Mhm.
There
in
has.
Cheshire?
I don't know if Marty, if you want to.
I can take that question. We are working on it. I'm working with the town, I'm working with legislators, I'm working with state officials. We're trying. We don't have anything concrete because we did not have a lot of time to react. We had about 2.5 months notice. So we are working because we believe that this community deserves healthcare.
Question regarding this transportation that you're gonna provide,
They didn't say they provided.
or assist this, yeah. So how does that work when someone is, I don't plan to get sick, that's an unexpected. So how is this transportation piece supposed to help us get medical care with the unforeseen?
So for folks that do not have access to transportation, the best thing that we can offer is working with the mover and others to help with that. Unfortunately, we're not a transportation company, but for what we offer for primary care, for walk-in, for behavioral health, we certainly have telemedicine. We also have the ability to work with other organizations to help with that transportation, whether it's ride share, we do gas cards for folks that they have a vehicle, but they can't fill it full of fuel. We're able to help. We have an algorithm with that helps them with that transportation.
We have no bus transportation in Charlestown at all. We do to Springfield, but it's like
very
once or
sporadic.
twice
It's like,
a day.
yeah, once or
one
twice
way
a day.
there and one way back.
Yeah, it's once a day.
We're working with the mover to potentially come up with that married to our scheduling system. So if we know what the schedule of the buses are, we can work with appointments saying if this person's coming by bus, we've saved this block of appointments. So that's what we're trying to come up with.
Well, you don't know when you're gonna get sick.
Well, the kid gets sick and you had to take the kid to the
Yeah,
doctor.
or you gotta go to the emergency room, I mean, there's no taxi. So,
If
And I
you
have a-
matter, that bus takes you up to 8 o'clock in the morning, you go sit there till 3, 4 o'clock in the
Yeah.
afternoon to get the
And
cut,
we
get
had-
bus
we
coming
had-
back.
that's your
someone
work day.
else-
I also just want to mention, we are not the emergency room, and we are not Springfield Hospital. So I want people to know that who we're not, and I know the CEO of Springfield Hospital is here tonight, so I just wanted to make sure people understand that this is not a Springfield Hospital thing. This is a Springfield Medical Care Systems or Northstar piece. Springfield Hospital has the Wyndham Center here. They also have physical therapy here. So I just wanted to make people aware of that.
So can Springfield Hospital get urgent, supply doctors for urgent care?
From my understanding, there is efforts, and I've been talking with folks individually as well to see if we can come up with some sort of solution. I just don't have anything I can report to you tonight. Yep, sir.
Yeah, obviously, I serve on a local board, and when I heard this in early October, before it was publicized, I was very concerned because this facility is so critical to our population, very needy population. And I can appreciate the business model problem. I understand that. But I also, what I don't understand is I would have thought that you had some kind of a little bit more of a commitment to this community. That the notice in October to close in December 31st, such short notice. I called Scott Pickup, our manager, and I said, "Have you heard anything?" He said, "I'm just hearing about this." I know we have our legislature. I think I saw
Leslie's here.
Leslie obviously is an important part of our community here. I don't know. I think she probably might have worked here.
Yeah.
But clearly, the community would have liked to have an opportunity a lot sooner than October to react to this and try to do something to ensure continuing coverage for our very needy people here. And so I guess the criticism is not that you have to make a tough business decision. The criticism is, I think you've handled it very poorly.
Yes.
And you really let these people down. And there could have been an effort on your part or your organization's part to work with our local government, our elected officials, our business community, et cetera, to try to find a bridge rather than to just cut us off.
Yes.
As many people in this room have, it sounds like, I have also had a provider leave with very little notice and no proactive communication around what's next. So the piece I want to speak about is when you do get through on the phones and you try to transfer care to Springfield, because I've had that experience now, I was literally treated as a new patient within the same healthcare system. I was treated as a nuisance, actually. I feel like by some people for looking for an appointment to keep my appointment schedules that were already scheduled out. So I'm also really unhappy that this is closing, obviously. I definitely use these services. I wish there was a different outcome, but I know there's not going to be. So what I wanted to say was, going forward, could you figure out a plan that's more proactive so that the continuity of care, moving people from here to Springfield, is not left up on us to call and figure it out and jam our way into people's schedules when we feel like we're being a nuisance? If you know you're gonna have all of us going to Springfield or Charlestown, it would be great to proactively reach out and make sure we're accommodated in that. About transportation, of course, but about scheduling, and that we know where we're going and we know who the provider is, because that has not at all been my experience fighting for healthcare.
I appreciate that. If anybody feels as though they're a nuisance in my organization, I want you to call me. And I want you to call me directly. And so my phone number is 802-886-8961.
And you get a voicemail.
Yeah.
My name is Tina Horn. I live in Putney. I'm here as sort of a general citizen of Vermont. And I'm part of a group that is working towards single-payer healthcare in Vermont, and the Workers Center. And have several groups throughout the state. And there's actually a law on the books for single-payer healthcare, except that there's never been the money to fund it. And it went on the books in 2011. And so we're working towards bringing a consciousness to that and exerting some pressure. And I'm hearing that your situation is impossible. As a person in a position where you're juggling budgets, you're juggling the stakeholders and the community members. And so these are sort of hard to bring together and make it work. And I'm asking about who the stakeholders are and where Northstar is in the huge conglomeration of healthcare companies. And asset management seems to really care about quality healthcare, and the burden is put on the locals for the finances, and they're extracting finances instead of it going back into the community. And this is something that is a national trend. It's happening all over this country, and Vermont is just on the list as far as I can see it. Because it's not just here, and it's a trend. And these companies are sending out consultants and telling us that we can't afford healthcare, but actually the money is there and it belongs to us. I think that we're the stakeholders, we're the true stakeholders. And so how do we reconcile that for someone in your position? Because I believe that you have a heart and that you want to do the right thing by your community. So I'll just put it out there. Who benefits from this? Who is Northstar and where are they in the big picture of asset management, which is basically AKA Wall Street?
So I will, let me first say who Northstar is. In 1982, we were incorporated as a not-for-profit 501c3 in Springfield, Vermont. It was a parent organization of Springfield Hospital. In 2019, when we went through Chapter 11, Springfield Hospital spun out to be an independent critical access hospital in Springfield, Vermont, and we spun out to be an independent FQHC, federally qualified health center, 501c3, same thing. So Northstar Health is not, we might have a flashy vehicle that we got in a grant, but we're not a Wall Street, we're not a stock, we are the same group that we were in 1982. Local, independent board, definitely not part of a big conglomerate. Thank you for that question. Lynn?
I just have two questions. One, is there anybody on the Northstar board that's from Rockingham? And then the second thing I would like to suggest is maybe like trying to help move forward, because somebody was talking about better transition, and is if there's an opportunity to have a group of Rockingham stakeholders, Rockingham patients, work with whoever is going to like be keying up the transition piece to actually have some representation and some voices and somebody that people can bring their issues and stuff to. So it doesn't necessarily have to go through the receptionist who's trying to schedule appointments, but it actually goes someplace where it goes to a place where the problem can be solved.
Yeah.
I'm sorry, I'm Lynn Raymond now.
So right now we don't have somebody representing Rockingham or Bells Falls.
Why not?
Why
not?
So she just resigned from the board not long ago. Somebody I think very highly of and worked with for a long, long time.
How long ago did she resign?
A couple months ago, I believe.
We should have a replace.
So we're always recruiting for board members. So Lynn, that was the board question. What was the second part of the question?
And the second question was about possibly setting up a committee of some of the folks, the Rockingham patients, Rockingham medical patients, maybe helping the transition, who can kind of help funnel through.
I like that idea.
Concerns as we go through the transition, so that it doesn't just go to the receptionist who gets the anger on the phone, but it goes to somebody who can actually communicate it to people who can make a difference and help solve the problem.
I like that idea. I'll look into that for sure. We have,
You can take a list of names before people leave. Yeah, I know. That would be a good thing.
yeah, it's true. Yep.
So I'm just curious, I heard about big grant money for Springfield, big grant money for Charlestown, and any grants that are applied.
Yep. So, you know, we're always looking at grants.gov, which is a website that has a lot of grants on it, different grants that we receive, specific use to different things. There is no current grant that we found that would help us with a property that we didn't own, that we could renovate, that we could fix any pieces of. We had investigated different sites in Rockingham, ways that we could move to less expensive space too, potentially to help us. But there's nothing available right now that we found. I'm worried right now too on what the grants to come are going to be in the future.
But you're a nonprofit,
Correct.
so it doesn't just limit you to federal grants. I mean, I do grant writing for a living. I work in development for a living. So that means you could look into private grants and foundation funding and things like that.
Yeah.
So I'm assuming that you've also done that as part of your due diligence in looking for that missing $800,000 and more.
Yeah.
Okay, so that would be the full answer to that question.
Yeah.
Okay, just double checking, because when you say you're looking at grants.gov, that makes me nervous that that's the limitation to what you were doing. And as someone who works in fundraising for a living, I get nervous when I hear that.
Appreciate it.
Just clarifying.
Hi, everyone. My name is Jessica. I work at Northstar Health doing the communications. I wanted to make two things clear. We are working on, so we sent out one letter initially before we had sent out the press release. Because of the way mail houses work and the capacity that we have as a team, I'm the only person really that works on communications for the organization. So we worked as fast as we could to get the letters out so that patients were aware before it went everywhere. What you did see, the first Facebook post that went live was a screenshot of the email that went out at the same time the letter went out. So the emails hit first and then the letters, so that spread like wildfire. If you didn't get a letter, it's because we have your email and we sent it there. We are sending letters, I believe, to every patient that has been here in the last 2 years that says where their provider is going, how to get there, how to park. That I don't know exactly where they are in the time frame of that. That was 3,500-ish letters. And so no one's job is to fold and stuff letters, so we're all trying to do it as we can. So just to give you a picture on that. The other thing I want to say, Lynn brought up maybe figuring out a Rockingham committee. I have a sign-up sheet here for name, phone number, and email. I'm going to send it around if you're interested in that. Put it here and I'll put the letters I'll put everyone's name into a list.
Thanks, Jeff.
Just one more comment. My brother usually goes here, and he had gone for dental quite a few years, about 1.5 years, 2 years ago. They closed the dental office, and there was nobody forwarding them out and sending anybody out. And because he's on Medicaid, it was very difficult. It took me over 1 year to find a new dentist. So I do appreciate, and I want you to know how much just moving people out for the building is. So I don't have to go find them another doctor.
Hi, David Mulholland. I live on the other side of Westminster near Putney. One of the concerns I have in the process was the short period of time between October and the change in January. Is this the human cost of, for the transition and the stress that the short period of time is obviously causing? Because one of the alternatives is simply take your business elsewhere. But that's not an easy thing to do, as you know, better than I, in the medical healthcare, primary care world, where there's not enough primary care providers. So as folks have angst, I believe, between now traveling further and finding somebody else, there's little prospect of finding somebody else versus accepting the hardships. So I feel like I'm put into a place where I really don't have a good choice.
Mm-hmm.
Okay. Personally, I feel like driving past Springfield and just go up to Dartmouth. That's how I feel about this. They're not going to close. They're not going to change. Whatever care is going to be there in some capacity. That's safer. Okay. So to be put in this position, I don't have a chance to really shop around in earnest. That's not comfortable. So if I drive to Springfield, it's because I've been forced to, not because I chose to.
So I know that you're not looking to provide, that Northstar can't provide transportation, but have you looked into maybe grants that would provide a specific transportation system for Rockingham to get them where they need to go?
Yes. Also looking at potentially private solutions that aren't necessarily affiliated with companies, but starting up with, like Uber rides kind of thing, those type of things potentially as well. So yeah, we are investigating those. I don't have any solutions at this time though.
We don't have any food.
No, I know. It was an example. Sorry.
Realistic thing would be to arrange with the mover to be able to have some kind of cycle that goes to Charlestown every day. That would have made more sense.
There's a bus company in Claremont, New Hampshire that we're currently speaking with potentially to help with the Charlestown.
They won't. So they won't go, the mover will not go across state lines. And so
They go over to Shaw's.
Yes, they do go across state lines. Yeah.
They do make 2 trips a month to Shaw's from Chester and Springfield. We are reaching out to several transportation services in the local areas to see if we can get them to work with us on providing more transportation, potentially coming up with more volunteer services. So it's all in the works, and we are putting in a lot of effort to come up with solutions.
Excellent.
So actually this is Helena. So she's one of our community health workers, and her job is to help individuals figure out what their transportation plan will be and to connect them to that. And in getting to know that, that will also help her and us work with those companies to get an idea of what the demand is. And so in those initial conversations, they want to help, and several of them are going to be here tonight. I guess they couldn't make it, but that will help them know what to do. At the beginning, it's very hard for them to make changes when they don't have an idea of the demand. And so,
who are you, please?
I'm sorry, yeah, I was just about to, so my name's Tom Doherty. I work with Helena in community health at Northstar.
Do you have an accessibility consultant or expert on your staff?
We're very familiar with our accessibility requirements. We do reviews on that to make sure that our facilities are accessible, and we get inspected on that.
See, I would say you missed a big one by not having a microphone here tonight. Just as a standard, like, you have a lot of people in a room, you don't know who can hear what. So I would question whether or not you need some additional help with your accessibility concerns on that front.
There's also no Zoom. We
There's
have
also,
fact-
right.
We have Fact TV, but there's hundreds of people that would have been here.
If you're already having trouble with affordability, how are you going to afford transportation on top of all of your costs?
That's really why we're trying to partner with somebody or receive a grant for that. So we don't have additional funds that we can put into transportation. Transportation is not something that we have in scope of our FQHC, but if there are partners or volunteers or folks that we can work with, we're willing to work with them.
Can you tell me sort of who these partners you guys are considering are?
The Mover is one that we mentioned, and that's one of the organizations that we continue to speak with. They help with a lot of ride shares currently within our sites.
And the grant would come from AHS or?
Maybe, depends on where. There's a lot of options of potentially where grants could come from. It's just finding the right grant, applying, and being funded.
So here's my concern. My brother-in-law is heavily disabled, barely makes it up here by walking. He's used the mover several times for appointments to go to other places such as Springfield and Dartmouth. And then he's had them not show up, cancel, call back to try and get another ride, and have him be denied for that. What is your solution for that? Because the mover is not always accessible, and they are not always reliable.
I do not have a solution for the Mover.
And it's not just the mover, it's other rides too.
Yep.
He's used Medicaid rides, he's used other rides, he's called here and asked for someone to help him find a ride. He is left out.
Yep.
My husband is disabled, I'm disabled. There are several other people I know that are disabled and elderly that have relied on Medicaid rides and have not had anybody show up. And then had to call a family member to leave work to bring them to the appointment so that they don't have a fee to be missed on that appointment.
So why wasn't somebody from Movers here tonight
Great question.
to answer some of these questions?
Statistically, 26% of the population in the United States is disabled, and that number is growing with the addition of COVID. That's a 2021 number. A quarter of the people in this room, by that statistic, are disabled. What type of disability it is doesn't matter. But the short time frame of this closure means that people who may not be able to drive, let alone all of the other considerations like missing work and other things, are being left in the lurch by basically having 8 weeks to figure out what to do. So not having something in scope for this closure that has to do with transportation is a very serious oversight when it comes to accessibility.
So I had reached out maneuver, and I was told that someone from management or multiple people from management would be here tonight to offer you information, guidance on the services that were available. And I do not see them here, but they did state that they would be here. We have reached out to Westminster Cares, which does only serve Westminster residents. We've talked to them about possibly working together to increase their volunteer service, the volunteers that they have there for service. There's also Southwestern Community Services, the Ride Share. I have reached out to all of these people, and we are working together to collaborate to see if we can come up with some solid solutions for all of you.
And you telling us this is great, but we should be getting emails with this information. It should be in the paper. It should be on Facebook. It should be on Front Porch Forum. I mean, I didn't get the letter that was telling me that my primary care physician was leaving until about 2 weeks ago. And that was way after it was in the papers. I don't fault you if you're a department of one at what you're doing. I understand that. I've worked in nonprofits for decades. I really do understand that. But what I'm saying is, these are really valid questions. And what I'm hearing is that you have a concept of a plan.
Yeah, I have a question about that. What's the magic, why January 1st? With so many things up in the air, why January 1st? With only 8 weeks to figure it all out, why are you not extending it a little bit further until some of these things can be resolved?
We don't have the kind of time that we would like to have.
I guess we don't either.
And as soon as we have all the transportation resources put together, and we have a solid plan with each service, we will send out information on that for all of you. Well, we have been consistently working with all of the people that I just shared with you, and have notified them that services will need to be increased, and that information will go out to you once we have further navigated what else would be available and to try to increase services for you.
So I plan to wrap this up at 6:30. I'm going to just wrap up with a few more questions. I've heard that we could do things better. I've got that loud and clear. Also assume that it's not over. The communication's not over. Assume that we are continuing to work on these problems. I thank you for sharing some of these very big hardships that people are dealing with right now. Again, communicate with us. We will do our best to communicate. I know Alina shared a lot of information tonight. We're trying to do the best we can. And I know it's not perfect.
The one question I have, knowing friends that are volunteers at Westminster Cares and having looked at the ride share for New Hampshire, if somebody needs an urgent care visit, that's going to be of no use at all for them. You know, it'll work for appointments known out, but not for the others. You know.
If there's an emergency situation, they would need to call 911 if it's an emergency.
Who's going to pay for the ambulance?
Yeah.
Well, any emergency situation, you should always be calling 911.
But it's not an emergency, is what I'm hearing.
No, I'm just saying, if you needed to be seen.
Well, that's a no-brainer.
Right, you gotta have volunteers, and if people don't volunteer to help, nothing's gonna change.
And as a community, maybe a good thought would be coming together to come up with some volunteers who might be willing to serve other members of the community. I know you were talking about, reaching out to, utilize the community members for finding resources for financial means. Well, maybe we can rack our heads to come up with something together, to come up with some volunteers for transportation. Be happy to speak with you further on the matter.
Chief, did you have?
I did. So my question was about the ambulance. So has there been any thought given to the potential negative impact on the current ambulance provider that this closure would have? So obviously, you said that they'd have to call 911. I see.
If it's an actual.
Right. I see actually a greater demand for the ambulance service that's already taxed as well already.
Which would also mean slower response times.
You had mentioned that you didn't have time.
Right.
What's going to happen if you wait 8 more weeks or 12 more weeks? What is going to happen?
Yeah, it's hard to answer that question. I can tell you that we're so fragile that us putting off decisions that have to be made could be catastrophic to an organization. And from my fiduciary responsibility, I have to make sure I'm taking care of the overall organization the best that I can. I know it's hard.
Yeah, I'd also like to mention that this will have an impact on the business community here because a lot of these 30 people are customers, having had a bookstore for 23 years. Many of these people were my customers. And they're not gonna be having lunch, they're not gonna be stopping at Leaside, they're not gonna be doing all the things that would normally happen. So that's a much greater economic impact on our community here.
Well, plus people buying homes. If you're looking at buying homes, you want to know where your closest medical center is.
Try to help with it, if you could, advocate on our behalf the best that you can. And I know right now you don't feel like it probably, but if you ever have the opportunity, for every single patient that we see, we lose $27. So if you can advocate for reimbursement changes for our organization, if we can at least break even, I'm not looking to have major profits. You see pharmaceutical companies having major profits, but you see small pharmacies closing. You see small independent FQHCs like mine cutting services. We need better reimbursement. We're trying to control our
We
costs.
need better premiums before I worry about
Yeah, yeah.
Thank you so much for
Yeah.
coming out.
In the
I'm
back.
not gonna let this guy melt down.
Hi, I'm Karen Hoover from Brattleboro and also a member of the Vermont Workers Center, which believes in single payer. But my question, or not really a question, my observation is, why did you feel that you couldn't share this with the community a year, 2 years ago? And I'm thinking, because I went to I read the the hearing that they had at Grace Cottage when the Lyman organization was reporting on their big report about these hospitals that were going to be possibly repurposed. Anyway, at Grace Cottage, the director brought up the fact that they have always had, shortfalls, and they get the community involved, and the community absolutely, just like you folks, want to keep this facility going here in this area. And same with Grace Cottage, and they would literally raise money for their emergency room and probably for their maintenance costs. I don't know that, but I'm assuming. And so I think that it could have been done so much differently, that I really feel for you. I feel that really a single payer is the better option, and that we have a plan that we are going to bring up again with our legislators. We do it every year, but so far, that plan has just been dormant. But it will reemerge, because I think the business model that you represent is not working, and it is not working in the rest of the United States as well as in Vermont. And we're just going to see more closures as we continue with higher health premiums. If you didn't read the article in the Commons, it said that we've had health costs rise 50% from 2023 to 2025. These are both real costs and estimated costs for 2025, and that it was it's 49% increase in healthcare costs. That is unconscionable, and it is unsustainable. We are, and they're already saying that by 2030, all of the hospitals in Vermont will be in a position where they can go into bankruptcy. There are 9 of 14 hospitals now in Vermont that are running in the red. It's the business model, stupid. So please think about it. We are going to have events in this area and around Vermont to educate our folks about the plan and about why should we struggle. The money is available. It has to be utilized in a different way without the very expensive middlemen that really make our healthcare system so unsustainable.
So I'm Dr. Hall. I'm the pediatrician. I've been here for 25 years. I certainly have a subset of my patients who has no transportation and arrive to my office on a daily basis by walking. And I think that subset of this community is going to have the hardest time with this transition. I had a experience a year ago when I practiced in Springfield, just on a part-time basis. And I will say that as much as that seemed like it was going to be a hardship, the patients did fine with it. They had a good experience there. I had a good experience there. It worked out fine. So I think for the vast majority of patients experiencing this transition, it's really not going to be a catastrophe. For some people, it's definitely a catastrophe, and those are the people that we're most concerned about. I will say on Josh's behalf that nobody was fired over this. Everybody was given an opportunity to choose, not to choose where they were going to go, but to choose, will I take that job in that location to continue my current job? So, I think the organization has been transparent with its employees. We know that we have some real deficiencies in the way that this organization has worked. So getting on the phone to call the office can be a very frustrating problem. It can require multiple phone calls, and it's a staffing problem. And these staffing problems have not just been in this FQHC, they really are occurring across the medical care system. As a consumer of medical care at Dartmouth, I have found similar problems. The physician says, well, just schedule a follow-up on your way out. Well, guess what? The follow-up scheduling person isn't there and hasn't been there for the last 5 times that I've been in that clinic. Okay, and can I get them on the phone? No. I have to get in the car and drive to Dartmouth to make an appointment. So we're not the only people that are having this struggle. It's a real struggle. I think it is a fairly tight-knit community, and maybe this is a great opportunity for the people who are invested in the community to come together and develop some solutions, which may involve some sort of structure where a pediatrician or a family practitioner or a urgent care provider can come and practice here 2 or 3 days a week. Maybe you had a pediatrician 1 day a week and a family practice doc 1 day a week. And we could see the people that don't have transportation or for whom transportation is going to be particularly problematic with a wheelchair or with, special needs that are going to make transportation harder. And I think the Northstar is open to those ideas. And it was kind of my hope that there might be some of that discussion at this evening, at this meeting this evening, because we don't want to abandon you. We care very much about our patients here. And we are open to those ideas. We would like to work with you. We would like to come up with solutions. And I think having this committee, maybe reaching out to other people who are sort of invested in our community, business people, people who have resources, and trying to come together to come up with solutions is going to be necessary, right? Because this is happening. Otherwise, the FQHC shuts down, and 30,000 people would be without health care because their primary care organization went bankrupt. And then we would be waiting a long time for somebody to move into this area, whether it's UVM or Dartmouth or somebody else. And we don't want for you to not go with care, right? Our biggest problem right now is that we're saying care for this community is going to be 10 or 15 miles away. I moved here from Idaho where people would travel 3 to 5 hours to come see me because that's how far it was to get to a doctor. So the fact that we live in a community where there are so many clinics, it's been a real treat, and it's been very convenient, and that convenience just can't be sustained in the current economic marketplace. So our clinics are competing against each other, basically. We have too many clinics for this organization. The patient volume has dropped off by about 20%, and so the money is not there to keep the clinics going. This clinic has a high, monthly cost to keep the building maintained and heated. And so instead of abandoning the people in the clinic, we're consolidating, we're moving down the road, we're still going to be here for you, and we'd like to work with you to help provide care to the people who really can't get out of this community for care.
Back.
Based upon what you're saying, is there a successful model that we could identify with and capitalize on their experience that's been a positive result?
There may be. So I can't say yes or no right now, but there may be. And we've had some conversations with some folks, but there's not enough tangible things to say, this is what we've got. We may in the future, but right now I have nothing I can share. I'm going to do 2 more questions. Yeah.
I'm just wondering, I had the fortune to be in England and be covered under NIH. However, and also in France, I did go into my local doctor there, and it was like $10 to go see the doctor. And it was $20 to have the doctor come to my boat at nighttime. Okay? But I happen to know from people that live there that regular care takes a lot longer. And in some cases, my friends in France had to go to another part of France to have a certain treatment because that wasn't available in Vermonton or Burgundy or whatever, and they had to go to the south of France. So healthcare, and I came back here 25 years ago. So healthcare now is so outrageously expensive. But it's not the doctors and all those people that are making the money, it's the insurance companies, unfortunately.
It's really, what Josh is talking about, advocating for FQHCs, is that Medicaid and Medicare do not pay enough for us to provide care. So all of the rest of the costs get moved to private insurers. So the private insurers, part of the total medical pie, is getting exaggerated year after year after year. And people like the Green Mountain Care Board are coming down on the FQHC or Springfield Hospital and saying, well, you guys can't keep raising those rates. That's not fair, blah, blah, blah. Well, guess what? If the federal government just paid their fair share, private insured people would be paying a dramatically reduced rate. And that's where the system is broken. That's the fundamental problem.
Or what Blue Cross negotiates, and that's what you're stuck with.
That's right. One last question, anybody? Yeah.
Well, just one other thing that we've talked about at the senior center with some of the older people than me, was that a lot, especially noticed after COVID and a lot of people getting sick and dying off, that it's the baby boomers are taking a lot of them are retiring now. So this problem's not going to go away. It's going to get worse because there's going to be less doctors because they're retiring or dying. So it's something we really need to think about for our future and not just expect our kids to get stuck with pulling a weed out of the backyard and giving it to us and hoping it works.
I want to thank everybody for coming tonight. We will take back what we heard tonight. We'll work on our communication structure as well, make sure that we're providing as much outreach, up-to-date information we can. Maybe we make a special page on our website specifically for this situation. And if people have additional questions, feel free to call.
I've been trying to check the website for about half an hour to get my message from Anna, and it doesn't work.
Our website?
Yeah, the FEMA website is terrible. It was cracking up.
So that is the patient portal where you can access your test results and talk to your doctor. We also have a website, northstarfqhc.org, where we post updates. Our social media, we post a lot of updates on there as well. And sometimes it breaks, yes. But we have a web developer partner that is supposed to be keeping an eye on that, and so it should be
I
up.
wish you just kept Follow My Health, and then our stuff would have been consolidated between Springfield and this, so that we don't have to check our test results in 2 different places.
We have a lot of ideas here.
Yeah.
Thank you, everybody.
Fair balance.